Looking after your personal health is very important, as the choices you make every day can have long-lasting impacts on your body and mind. There are different ways that women can manage their physical and mental health, especially in a busy environment where there are many things that tend to take higher priority. Breast cancer represents 28% of all reported cancers in women and continues to be the most prevalent cancer among women in Australia. Early detection is the key, and the rate of survival continues to increase, with 89% of women diagnosed with breast cancer surviving over 5 years beyond diagnosis. Changes you should look for include a new lump or lumpiness, specifically in one breast, a change in the size or shape of your breast, a change to the nipple, such as crusting, ulcer, redness or inversion, a nipple discharge that occurs with squeezing, a change in the skin of your breast, such as redness or dimpling, or an unusual pain that doesn't go away. Iron is a component in red blood cells responsible for transporting oxygen to the rest of the body. The three main functions of iron in the body are transporting and storing oxygen, energy production and cell respiration, boosting the immune system by helping to produce white blood cells to fight bacteria. Women require higher levels of iron than men due to the blood loss experienced during menstruation. A diet low in iron and vitamin C and frequent dieting are other reasons why women may become iron deficient. You should maintain a 15 to 18 milligram intake of iron to meet your daily requirements and increase energy production. A well-balanced diet is an integral part of staying healthy. Women's nutritional needs tend to change during each stage of a woman's life. Before menopause, iron-rich foods such as red meat, chicken, pork, fish, spinach and lentils are vital to good health and energy levels. Women reaching childbearing age need folate from foods such as green leafy vegetables, avocados and beans help decrease the risk of birth defects. In elderly women, adequate amounts of calcium and vitamin D are essential in keeping the bones strong and healthy, which helps reduce the risk of osteoporosis, which affects more than 1 in 5 women over the age of 65. Stress is affected by many factors such as past history, life events, genetic factors, and medical history of depression and anxiety. Stress increases risk of depression and anxiety disorders. Maintaining a healthy work-life balance is important in sustaining energy levels and navigating the chaos. Take time out of the day for yourself, whether that be exercising, reading a book, or yoga. It won't kill you to take some time out. For more information, talk to your GP.